everyone, I'm Bevin Victory of Victory Doula and Birth Services in Cleburne, Texas. I'm a local doula and childbirth educator, and I'm here today with Dr. Landon Lorenz of Meridian OBGYN in Cleburne. How are you today, Dr. Lorenz?
Good. Glad to be here, Bevin.
Awesome. Thank you so much for joining us. For our viewers, if you're tuning in, feel free to add your questions and comments into the comment section of the video, and we'll be sure to check it before we finish the video. So, are you ready to get started?
Yeah.
Okay, awesome. Well, we would like to know how long you've been in Cleburne and how did you end up here? Why Cleburne?
Well, my family, we moved in late August of last year, so we're newcomers, and there was a lot of work getting the practice open, and we opened our doors in late October, so we're at roughly the 6-month mark here having the practice open. I had been in private practice for a few years immediately after residency, which was about 10 years ago for me. I was in a group of 5 in New Mexico and did that for several years, and then had the opportunity to go back to the University of Oklahoma, where I went to medical school and did my training as a faculty member. And so we relocated to Oklahoma City, and I was at that position for about 7 years, which was a good experience. But I came to the conclusion that I thought private practice again would be a good opportunity for me. And so we kind of started looking for a community like Cleburne where there was a need for my services and support from the community and the hospital to get things going. And the hospital here was recruiting and has assisted us in getting this practice up and running.
Awesome. Well, we're so glad you ended up in Cleburne. I'm happy to have you here. So tell us a little bit about your practice. What's the feel and what do you want people to know about it?
Well, what we're striving for is to really provide personalized care. And, we're a small, new practice with me now as the sole provider. So I think it gives us the real opportunity to get to know our patients. In pregnancy, we see them monthly, every other week, and then weekly visits. So we see our patients a lot, and compared to other practices that I've been involved with that are higher volume, we have a better sense of when our patients are, struggling with something or having a bad day or looking tired, and that's been nice to be able to have that. The other aspect to it is, it's increasingly difficult to coordinate healthcare with insurance companies and the medical practices, the hospital. What we try to do and continue to work on is being able to coordinate that for our patients so that it's an easy experience and that they're not having to worry as much about putting all those pieces together.
That's awesome. I know women are really looking for that feel of a relationship with their provider and feeling like you notice when they're having a bad day, and you can come in and just really be seen. So have you always wanted to be a doctor? Is this something that you've always known you were meant destined for?
Yeah. I mean, I think going back to it as a child, I always thought about it as certainly a potential career option for me. My grandfather, my mom's father, is a physician, and he was a family practitioner but did a lot of obstetrics. And when I was in medical school, I enjoyed the experience. I enjoyed the people who did it, and I remember that being a really rewarding part of his practice. So I think that's a small piece of the explanation of how I got to where I am.
Awesome. So what's something you're really passionate about professionally now that you've gotten into this field? Yeah,
obviously being a part of pregnancies and the birth process is special and exciting, and that won't ever go away. But increasingly from a professional standpoint, I think what really drives me is trying to optimize outcomes, whether it's for pregnancy or just woman care. We focus so much on the pregnancy and the birth, and that's how insurance companies view it, but really there's so much that needs to be done when people are thinking about becoming pregnant or planning a pregnant or wanting to time their pregnancies or delay a pregnancy to work around other factors they have going on in their lives. being able to focus on that and put more effort into that is something that I really care about.
Awesome. Very good. So for the local moms, we would love to know if you work with VBAC births, if you work with twins, breech, will you do water births?
All of the above. VBAC, I think it's a great asset to the community that we have a smaller hospital that can offer vaginal birth after cesarean, and so that is something that we do offer here in Cleburne. Twin pregnancies, I manage twin pregnancies. I think I have one set of twins in my young practice right now, and they're very early, so that'll be exciting to watch that move along.
Yeah.
And I had at the university more experience dealing with twins. For breech, I would struggle with the way science is and the way the standard of care is now to be a huge fan of a breech vaginal delivery. I don't, from a philosophical standpoint, necessarily think it's a bad option for people, but it would give me a little bit of heartburn. But I would encourage, and I have encouraged without exception, patients who are term and in breech presentation to at least try an external cephalic version.
Okay.
And so that is
an
an
option.
offered service, yeah.
Awesome. Cool.
And then water birth. Limited experience. I've done one here in Cleburne. The previous hospitals that I worked at haven't had the right tub situation. And it was a good experience, and I think that's something that we'll continue to offer to patients, and I'll enjoy getting some more experience with.
Yeah, it can be an awesome experience, and it's so cool that they offer it here at the hospital as an option for moms. So how do you feel about couples who would like an unmedicated birth?
Well, I think that patients and families should be able to choose the way they want their birth to go, and
so you're on board if they say.
Yeah, what I think is important, and what I hope to achieve with my patients is that things don't always go as planned, and sometimes plans need to change, and to be able to have that flexibility without ever feeling that there's a loss or that you failed in some way is really something that I like to stress with patients, and hope we can get to a point where that's how we view it.
Right, and not just fixate on that one.
Right.
Well, that's how it's going to be for any parts of their birth plan. I like to tell couples that it's your birth preferences, and you have to be flexible, and you can prepare for a certain experience.
I think unmedicated births have the real potential to go very well and be a rewarding experience for patients, but it does take some preparation and some understanding and some flexibility.
Yeah, definitely. Okay, so what kind of support would you like to see more of for couples during pregnancy and birth?
Well, for pregnancy and the postpartum period, what one of my biggest perceptions of where we fail in serving our patients is with emotional support. Not just depression, but depression and anxiety, just the emotional stress of going through a pregnancy. A lot of my patients don't have great social or family support. A lot of my patients, the pregnancies weren't necessarily something they were ready for in their lives. And so providing emotional support is not something we do a great job of. So that's that's something that I think we should try to do better on. The same goes with the postpartum period. Having a new baby in the home, no matter how experienced you are with having children, is always a stressful event. And I think often we kind of have the birth and we'll see you in 6 weeks, and that's there's a gap there of serving our patients well. For the birth process itself, I think that patients often aren't prepared well for what is normal and what to expect.
Right.
Going back to the issue of an unmedicated birth, patients need to know that discomfort or pain is okay, and that's to be expected,
Correct.
And
That's part
to
of it.
have a plan of how that's going to be dealt with. And you see that in the antepartum period too. Patients have aches and pains in pregnancy, and nausea and vomiting, and all kinds of issues that come up, and they're not quote unquote normal, but they're to be expected, and often if patients understand that it's okay and it's a normal thing and it's not anything we need to be particularly worried about for you or for the baby, that in itself is good medicine.
Definitely. Awesome. So switching gears a little bit, tell us about your family. Do you have any children yourself?
Yes, we have 3 sons, 11, almost 12, 9, and 5. So
Wonderful. We're
going from 5th grade down to kindergarten now, and it can be a busy house sometimes.
Okay. Awesome. Good. So, being somewhat new to Cleburne, what's your favorite thing so far?
Well, the slower pace. People have been quite friendly, accepting, and it's got a really comfortable feel to this community. From a practical standpoint, I like that my house is 2 minutes away from my work.
Yes.
For what I do, that's a huge point of convenience. But just everything else, it's not a hassle to have to go to the grocery store or the cleaners or the bank. Everything is easier, and you spend a lot less time in your car or waiting on things here, it seems.
My husband does talk about the Cleburne noon rush traffic.
Well, and at the corner of Nolan River Road and Henderson, at about 7:30 to 8, when the kids are getting dropped off for school, it can get a little dicey then. But small town troubles nonetheless.
I know, it's still pretty great. So when you're not working, what are some of your favorite things to do?
Well, I've often told people that doing what I do is excitement enough, and that I don't need any extreme sports in my life. My wife and I both work pretty long weeks, and when we do have time off, we like to downshift and just spend time with each other and with our family. We read a lot. We binge watch Netflix series, and try to keep things low key. We do like to travel when we have the opportunity.
That's awesome. What are you watching on Netflix right now?
I don't even know if I should admit this. Shameless is what we're watching.
Shameless.
Yeah.
I haven't seen that.
It's not safe for all viewers.
Okay, right. Well, we watch after the kids go to bed, but we watch fluffy shows. Is there anything else you would like us to know?
Not that I can think of off the top of my head.
Okay, cool. Well, I had one question that was posted in the event discussion. So Ashlyn asks, I would love to know what is beneficial for you as a doctor, as far as educational level of moms during labor.
Well, as I mentioned, the more a patient is prepared for what to expect in that process, the better suited she's going to be for what comes along. From a doula standpoint, not only setting up expectations and dealing with issues before the birth process itself is important, but also there's the physical support of assistance that a doula can provide, and that to me can be the difference in a really high quality doula experience, and maybe not so much that those who can provide that physical touch and support really benefit the patient.
Right, yeah. So she goes on to ask, what is your preferred style of doula, and what is most helpful to you as a provider when a doula is present?
To be an advocate to the patient, and to try to involve the patient's partner and support structure in the process. I think a lot of times partners feel sort of overwhelmed and lost in the process. Definitely. And to be able to fill that role and involving the significant other is important, along with what I mentioned, the physical support and management of expectations and discomforts.
Right. Yeah. For me personally, I don't particularly like to describe myself as a birth coach, because that kind of implies that I'm jumping in and I'm doing all the coaching and dad's kind of off the hook. But I'm really there to support both mom and dad, and give dad ideas of what to do and make him look like the rock star. And I'm there for both of the mom and dad. So Can you see, so you can see a big difference in couples who go in educated, like they've had a birth class, versus they are not quite sure what they're getting into?
Well, the confidence that a mom has is a huge difference.
Mm-hmm.
But I mean, even if you look at the medical literature on the subject, I mean, you're looking at less use of pain management and other medical interventions, less use of Pitocin for labor augmentation, lower cesarean delivery rates. So having a support person who is not a family member and not hospital staff really makes a difference, and I think that most people would agree with that.
Okay. Awesome. Well, thank you so much for sharing.
Yeah, thank you.
You're welcome. If you would like to reach me, my website is victorydoula.com, or on Facebook, I'm Bevin Victory Doula and Birth Services. And how can people reach you if they want to find your information?
Our website is Meridian OBGYN Cleburne.com. Awesome. And our phone number is 817. I'm new to the practice. You'll have to go through our website.
We can look it up on the website. Okay, wonderful. Well, thank you so much for visiting with us today, and we'll see you soon.
It's been a pleasure. Thank you.
You're welcome. And thank you, everyone, for joining us and watching, and we will talk to you later.